We are now live on Facebook, and we're going to give it just a couple of minutes to get everybody onto the call. We know we have folks streaming in, so we'll give you a few minutes to get here. Thank you so much for being with us. We're so happy that you're here for this conversation with our incredible speakers. So as you come into the Zoom call, please feel free to let us know you're here. Say hi in the chat, tell us your name, your congregation, your organization, if that makes sense. And we'll be able to welcome you in that way, and that'll be awesome. So again, thank you for being here, and we'll just kind of let it roll as we get the folks in Zoom into the call. Thank you so much. All right, and then as our other staff folks kind of help us get people into the call, I'll go ahead and get started. So again, welcome. Thank you for being here. Good afternoon. My name is Sarah Ogletree. I am the program coordinator at North Carolina Interfaith Power and Light, which is the Creation Care and Climate Justice program of the North Carolina Council of Churches. And it is my honor to welcome you to the second event in our Voting Our Values series today. I am so grateful to be able to welcome you. Thank you for being here. Today, we are going to be talking about voting on the values of moral health care policies. And we are so grateful to have with us Nicole Dozier from the North Carolina Justice Center and Brigid Flaherty from Down Home, North Carolina as our speakers, in addition to our very own Chris Pernell, the director of the North Carolina Council of Churches Partners in Health and Wholeness program. Chris will be facilitating our conversation today, which is going to be so wonderful. And thank you, Chris, for serving in that role. We're so grateful that you are here. So after we talk a bit about how health is on the ballot this election cycle, I'm going to offer some resources for voter education to ensure that all of you attending feel prepared to educate your own communities about this election. And we will also have a Q&A session and an opportunity for you to ask questions of our speakers. I'm sure there'll be lots of questions. There's going to be lots of great information. As you have questions, go ahead and write those in the chat here in the Zoom call or on Facebook Live if that's where you're viewing this. We will flag those questions for the Q&A. And again, go ahead and say hello to us. We would love to know who you are and where you're calling in from so that we can say hello to you and welcome you to this call in a more personal way. Lastly, I just want to note that this forum, in addition to our entire Voting Our Values forum series, was inspired by the Democracy, Values, and the 2020 Election Voter Guide, published by Faith and Public Life in partnership with Interfaith Power and Light. So this guide was created with faith communities in mind, and the North Carolina Council of Churches is the only group distributing this in the state of North Carolina. So please, we want to ask that all of you attending download the guide and encourage your congregation and community members to do the same. The link to do that has been placed in the chat, and by downloading this guide, you help us communicate why voting our values matters this election cycle and certainly every election cycle. So again, thank you so much for being here. Thank you for helping us to circulate this important information. And now I am going to pass the mic to my friend and colleague, Chris Pernell, Director of Partners in Health and Wholeness.
Thank you, Sarah. I have to tell everybody the last time I presented on Zoom, I put my notes over the camera and disappeared. So if something like that happens again, just wave and I'll try to pull that down. Really appreciate you being with us today. As the director of PHW, Partners in Health and Wholeness, I get to work with a team that is very dedicated to everyday issues related to our physical, mental, and spiritual health. A lot of those folks are on screen. If you will either wave or say hello in the chat so everyone will know who you are, that would be awesome. And our program works with faith communities directly across North Carolina and anything health related. But we have a special focus on reducing overdose deaths, mental health, and healthy aging. We could spend this entire hour talking about PHW. We do a lot of wonderful things, but today we're talking about healthcare policy and voting. So I just want to encourage you to check out our website at healthandwholeness.org and to reach out to any member of PHW or the council at large if you have questions or want more information or want to talk about your health ministries. We would love to work with you. So one of the reasons that we're on this call today in this time is that we believe healthcare is one of the absolute most important issues in this fall election. And one of the reasons we believe that is North Carolina is consistently in the list of the largest uninsured populations in the United States. And that was well before COVID. Even before COVID, we had over 1 million people in North Carolina who do without health insurance. Through May of this year, after COVID, already an estimated 238,000 people have been added to that number as folks have lost their jobs and consequently their health insurance. A recent report by researchers with Families USA lists North Carolina as 5th in the nation for insurance coverage lost due to COVID. So it's a very timely conversation as we look to the fall and elections and healthcare policies. Because unlike a lot of things in our lives right now, we actually do know how to fix this. And with that, I would like to introduce you to 2 amazing folks that we work with who work tirelessly to make healthcare a human right. First up is Nicole Dozier. And Nicole is nearly a 24-year veteran of the North Carolina Justice Center and is director of the Health Advocacy Project, working statewide using policy advocacy, community and partner engagement, and communications work to push for quality, affordable, and equitable health care. Nicole and her committed colleagues keep people who are directly impacted as the centerpiece of their work and defend against threats to coverage, implementation, and access to health care. Nicole is also an elected official, serving in her 2nd term as the Mayor Pro Tem of the Apex Town Council, where she created the Think Apex initiative, championing the addition of a senior community center, is founding chair of the Environmental Committee and chair of the Personnel Committee, championing paid parental leave, caregiver bereavement leave, and expanding the definition of what family means under FMLA, as well as working for living wage. Nicole has served on numerous committees and boards aimed at improving the quality of life for North Carolinians, and is currently active with the North Carolina Council of Churches Governing Board and the North Carolina Black Alliance of Elected Officials and the North Carolina Black Elected Municipal Officials. Thank you so much, Nicole. Joining Nicole, we have Brigid Flaherty. Brigid is the co-founder and co-director of Down Home North Carolina, a grassroots organization building power for working communities in rural and small town North Carolina. She was most recently the organizing director of Align, where she led winning policy campaigns at the city level that strengthened standards for 4,000 commercial sanitation workers, as well as improving public health for 3 overburdened, low-income, and people of color districts. Drove labor community coalition mobilizations around Fight for 15 and various other Wall Street actions. Prior to Align, Brigid worked for 7 years as the Pushback Network, where she eventually served as executive director. At Pushback, she worked with the board to drive strategic planning and fundraising for a national network of 8 states that were building power with people of color and low-income community organizations. Brigid has also been a resource partner for the PHW team in our work with faith communities working to reduce overdose deaths. Thank you, Nicole and Brigid. So I want to begin with a question that kind of gets to the heart of why you do what you do. And I would love for each of you to answer this from your perspectives. Can you share with us what experiences in your life built your passion around health and healthcare? And how do you see this as a moral issue?
I guess I can start. I first learned about it when I learned from my parents, actually learned a little bit about the history of how Black bodies were treated, how descendants of people who were enslaved were treated, and so and how it touched my family. So while we hear often about the Tuskegee experiment, my mom's cousin was someone who became a hunchback because someone thought it was funny to experiment on his body. Also learned later that there's Dr. Sims, who was supposed to be the father of gynecology, but he got that reputation, and we benefit from that because he mutilated slave women, people who were enslaved, their bodies, women's bodies. And so So the things that I've heard, the things that I've read, but weren't often in front of me in school settings, though, sort of set the stage for what I thought I should do with my life. And I'll say, the final thing too is I had an aunt who had boils and on her face and went to seek treatment at what is now Vidant Hospital and came out, having been mutilated, and they went rogue. She wasn't even part of the system of eugenics practices where social workers and providers were deciding that certain people didn't deserve to have children. They just went rogue. She wasn't part of that. And so those are the things that made me decide that, that I should use what I've learned and what I know, and who I am to ensure that people know that all of us are human. And as a person of faith, I'm fearfully, wonderfully made. That's clear to me. But that we in this country have failed the moral test of government. And I'm going to be here to make sure that I raise the voices of people and their experiences who are demonstrated in results of that failure of government, rooted in racism and hatred at the beginning of the founding of this country.
Wow. Thank you so much, Nicole. It sounds like this has been a lifelong work. We really appreciate that. How would you envision a moral health policy? What does that look like?
Mm-hmm. So I'd say it's definitely not a system of Band-Aids. And just remember, people say the system isn't working. Well, it's working the way it was intended. It wasn't intended to work for everyone. And so while none of us here created that system, erected those barriers, we certainly are recipients of it. So it's up to us to build that system that works for everyone. And so I think, while we work daily on ensuring that the Affordable Care Act can be fully implemented, including the Medicaid expansion piece, I realize that's just one of the steps to get us to universal health care. And so I think Chris has some information there. I'm not an expert on Medicare for All. Rebecca Cerise on my team is, but I do understand that Medicare for All means that everyone's covered and, everybody in, nobody left out. And that people keep asking about paying for it. Well, we're paying for it already. 1,100 people die every year just because they have no access to care. So for me, it would be a system that worked for all, and where people of color and women and people who have different gender identity, that providers don't get to treat people differently, and we get to challenge each other about what people may not recognize. I think implicit bias is something we keep talking about, but we got to deal with what's explicit as well.
Absolutely. Thank you so much for that. And thank you for mentioning the steps in getting to coverage for everyone. We do have some information that we can drop into the chat box. There is an event tomorrow. If folks want to join, there's a coalition in North Carolina called Medicare for All. And there is an event tomorrow to talk about that, give the opportunity to ask questions. And that same event will actually be available in Spanish next week at the same time. So we can drop those links in.
Yeah, and I believe Rebecca's one of the speakers, so yeah.
Yes, she is. Thank you so much.
Mm-hmm.
Brigid, can you share with us?
Yes, and thank you so much for the NC Council of Churches for inviting me, and it's really an honor to be alongside Nicole and speaking about this. I just think already our values as a country have gotten so twisted that we even have to ask a question like, how is providing healthcare for our people a moral issue? Like point blank, like life is precious. And we as a human community have a moral obligation to provide care for each and every one of us, and really not to worship at the feet of profit, which I think has really skewed our ability to actually be able to provide healthcare for everybody. I'll say before going into my own story, because it directly ties into it, that I just think it is unethical, and which is the nicest way to put it, to ration healthcare according to someone's ability to pay. Any society, especially as one as wealthy as ours, should not allow people to suffer and die because they're poor or they're a working family. And how that relates to my life, my own husband doesn't have healthcare. He has been unemployed it's very scary because COVID is making it so that it's even harder to think about what a future job will look like. And I had a baby about a year ago, and I nightly worry what would happen if something happened to me. Luckily, my daughter has healthcare under my insurance, but he hasn't had healthcare for years. And I hate the fact that we are always, you know, when he gets sick, it's sort of like, what can we do first before we can get you in? And I just know that this is an experience that so many people have, and it just at my core makes me just so righteously angry. I'm also dealing with a mother and a sister who have substance use disorder issues, and they are not able to get treatment because also they can't afford it. And I have to suffer through calls of my sister getting in car accidents because she unfortunately was not healthy and her child was in the back seat, and my sister is struggling to get better. But without a system that is humane and can provide her care without money, I'm wondering every day if I'm going to get a call that says I've lost her to overdose. And I know a lot of families like mine are going through the same thing. And I just never, I want to stop it because I want to stop my pain. I want to stop my sister's pain, my husband's pain, my mother's pain, and I want to stop everybody who I don't even know. I want to stop their pain because we deserve better. And so, you know, again, it's just, I just will always reiterate this, that like almost every country in Europe, Taiwan, Japan, they all have universal coverage. How come we are still being driven by a debate around like, if you can afford it, therefore you should get it? You just, I think, in ending this, I just want to say, like, I think the key ingredient for this conversation is that we just have to say that we need to take the profit motive off of having basic health care. That's the completely ethical way to frame healthcare policy right now. And, you know, the fact that we've been market driven has just really blinded us to how we are humans that need to show up and care for each other because we all deserve it.
Absolutely. Thank you so much, Brigid. It's so important to put a human face on the statistics that we hear about and we all talk about. A lot of us who do this kind of work talk about that, but until you really experienced it or had a loved one, it just adds a whole new dimension. Thank you so much. Nicole, I'd like to ask you if you could just share a little bit about what is the gap in North Carolina? We hear a little bit about folks standing in the gap and being lost in the gap. Who is in the gap and what is that, and how? Talk a little bit about the inequities in healthcare access for North Carolinians.
Yeah, sure. So when the Affordable Care Act passed, you know, people were excited that, you know, for the first time in history, you know, we would have more and more Americans with coverage. But what happened with attacks from conservative governors and Republican congressional members strategically through the Supreme Court carved out the piece, the Medicaid expansion piece, which was the piece that would help attack health inequities because surprise, all people who have low incomes don't get Medicaid. And so, yeah, that was the piece that was going to allow a person with zero income that didn't have minor children, for example, to get Medicaid. But once that was carved out of the Supreme Court's decision that it was carved out of the ACA, it left it up to states to decide whether they wanted to do that or not. So in that very moment, we saw, you know, even conservative governors saying, you know, so you mean to tell me that we can expand Medicaid in our state to more than people, women who are pregnant, which it only gives them coverage for 60 days postpartum. And we know it could be 90 days when postpartum depression can present itself, for example. For people who are in nursing homes, typically have Medicaid or older and dually eligible. And then children whose parents are at 200% of the federal poverty level. So there's the only parents, only people who are not in the categories I just mentioned of these, in quotes, deserving categories, are parents who are 50% of the federal poverty level. So you're talking $8,000, $9,000 a year. So we know that there's too many people left out. So, I would say that we started seeing conservative leaders saying this is a win-win. Our people get coverage, and guess what? The federal government would pay 100% of the cost for the first 3 years and step down. Now, 98, 97, step down. 90% would be the bottom, and it would take a little act of Congress for that 90% match to be reduced. In North Carolina, our match is, they pay 60% of the cost and we pay the remainder. So I think that was a great bargain for us. It would bring in jobs, and just not even just jobs related to healthcare, but jobs that are related to that, and boost the economies of rural hospitals. You're talking about millions of dollars. We're losing people, losing $4.9 million a day. So in our state, our lawmakers decided that they would pass legislation that only the General Assembly could decide, and couldn't just be leadership from the governor, which has happened in other states. So our legislature decided that they would not expand Medicaid, and that people just needed to, I guess, find their imaginary boots and the imaginary bootstraps and try to find them. So while people are looking for boots and straps and all, we're telling people that only deserving people should have Medicaid. So we had over 500,000 people in that gap, and they are people who are working to take care of our children, our elders, serving us. And I'm talking about pre-COVID, but serving us in many places of, food, beverage, and all. People who are building our towns. And so to me, that kind of sounds familiar. The people who are really taking the most care of us and now they're essential workers. And we're not protecting them with COVID. I would suggest that it's past time for our lawmakers and our leaders who are stopping any real legislation and passing that would provide coverage to people and do their essential work and provide insurance and protections for the people who we've now shown that health insurance tied to work does it. Mm-hmm.
Absolutely. I really want you to say that a few more times, but we'll reiterate that in the notes.
Brigid's got me on that.
I know she does. Brigid, actually, if I can move to you for just a second, if you all are not familiar with Down Home North Carolina, it's a fantastic organization that does grassroots work, literally knocking door to door pre-COVID, but on the phones, talking with just people of all across North Carolina, real people living the day to day. And I wonder if you could share what your people are hearing. What are the top issues for especially rural North Carolinians around healthcare?
Yep. Yes, definitely the door knocking was pre-COVID. We have had to move to phones, but we started in 2017 really talking to rural North Carolinians on their front porches and inside their living rooms. And I feel like, across the country, the stat is about 60% of folks living in the US actually favor Medicare for all. And I would say that is exactly true for rural North Carolina. Healthcare, access to healthcare, treatment for substance use disorder. These were top issues. Number 1, expand Medicaid. Number 3, ending overdose. Rural North Carolina is in a healthcare crisis. 40% of our hospitals are in the red. Women are losing their maternity wards. They're closing down, if not, again, full shutdowns of their hospitals. People are driving hours to get care. This is just unacceptable, and people are coming together in Down Home and in rural North Carolina to really fight for Medicaid expansion, number 1. I will also say that, North Carolina, the overdose crisis, if it was disastrous before, it is only getting more disastrous. 5 people die from overdoses every day in North Carolina, and this was pre-COVID. They were saying in 2017, you had 70,000 deaths from overdose, which again, more than the Vietnam War, more than, car crashes. But in North Carolina, of that number, 2,000 died of an overdose in 2017, which is a 32% increase from the previous year. And basically, the number of unintentional opioid overdose deaths in 2017 was nearly 17 times higher than in 1999. You know, we are seeing such an unnecessary loss of life. I started door knocking in Haywood County, up in the western part of the state, and it just really did. It felt like every other door I was knocking on was a combination of, I don't have health care, my daughter has cancer, and I don't know what to do for her. I only work part-time because the jobs have left, and so therefore I can't afford it. Also, I have needles on my street, or I have been struggling with substance use disorder. Like, it's just, the pain is just so felt. 20% of children that were born in Haywood in 2018 had some level of opioid addiction already. And we need to really look at these crises and again, be able to push for policies. When you push for Medicaid expansion in North Carolina, you are pushing for an expansion of treatment of substance use disorder. And that is why we are that's why we're fighting on both fronts, because they actually are able to boost each other through those wins. So, you know, I really will say, I think those are the top two issues. And part of it's not only looking at how do we expand Medicaid that will also expand treatment for folks suffering from substance use disorder, but it also will help keep our rural hospitals open, because that is true. Not only North Carolina, but the southern region in general are the states that most likely have not expanded Medicaid yet. And that's where the majority of rural hospital closures are being seen. And in addition to that, we need to definitely increase distribution of naloxone. It's been a key aspect of some of the work that we've been doing to save lives, because everybody deserves another chance at living. We need to implement more syringe exchange programs. We really need medication-assisted treatment that is covered by Medicaid, not only in places that can offer it, but also inside of our jails. You know, everything gets connected. So how we're really looking at decriminalizing substance use disorder, how we're making sure that folks are getting taken care of if they actually are inside of jails with medically assisted treatment. These are all the things that we are fighting for, because we know that, like I said, there was maybe a dip in overdose deaths that we were seeing in North Carolina around 2019, but they have only skyrocketed now. COVID and the ways that it's impacting mental health, it's impacting unemployment, it's impacting access to healthcare. You know, we're seeing the crisis really increase. So we need to be able to do these things to save our people.
Absolutely. Thank you so much. There is so much connected to the overdose crisis in North Carolina. There are very few families that we have touched over the last couple of years in our work that have not been impacted in some way. So we have a lot of information on our website if anyone is interested in learning more about what's going on and how you can help, and particularly how faith communities can help and have been very effective in many instances. We would love to share that with you. Thank you, Brigid. Nicole, we're going to move over to Raleigh for a moment and ask you to share what's happening with policy this year in North Carolina. Not all of it, we don't have that much time, but could you hit the highlights on policy in North Carolina? We know that the Affordable Care Act is under attack right now. And talk a little bit about the down ballot. You know, the presidential election it's kind of sucking all the air out of the room. Mm-hmm. And those down ballot elections are very important. Off year elections are very important. Can you talk a little about that?
Sure. So in Raleigh, I think folks know that the General Assembly came back in to deal with COVID. And what some may not know is in the House, the Speaker of the House actually set up a bipartisan committees. Voting was one too, but healthcare, education, different issues. But also there was bipartisan leadership, co-chairs, where people of color, also and women, which is something, if you look at the committees outside of COVID, it's not bipartisan at all as far as who runs committees. And so what we did, along with our coalition partners, and including Down Home NC, was to ensure that people in North Carolina knew about that. So they would put the public comment in related to all those issues, and to drive the conversation about what should happen in a pandemic. And so, well, I guess they went home, and with unfinished business, they dealt with some things, but they did not expand Medicaid, even though we had the bill that could have expanded it that day. The Clean Medicaid expansion is what we need, free from barriers related to work, obviously, because we talked about workers. Work reporting requirements don't work, and a judge agreed with us. And other states talked about how premiums don't work for people who are on Medicaid. And in this moment, I think COVID-19 proved that too. So we still didn't expand Medicaid. So we do know that the COVID-19 task committee is going back in on August the 20th. We'll be watching to see what happens. And what was neat is that Secretary Cohen, when she presented to the Joint Legislative Oversight Committee last week, and her staff, they really did not run away from saying, Medicaid expansion would have provided this. Medicaid expansion would have done this. And so in this moment, I think people should be focused on asking and urging leadership to deal with Medicaid expansion during a pandemic that is health and economic, and this moment where the whole world is looking at us reckoning with racism all of a sudden because we saw a man murdered and narrate his own death, at the hands, in the pocket of law enforcement. So what's not happening is Medicaid expansion. And it's related to voting. You're right. I mean, we keep talking about the federal level. So while we do have that to keep an eye on, and people should be engaged and thinking about voting in people who care about them and their issues, but also, we have, for this year, we have our county commissioners, you have your, even their citizen advisory boards. We have planning boards that then feed into council and things like that. People should think about, we have lieutenant governor, so the lieutenant governor serves when the governor cannot. So you think about who are the people we want? Who is the person we want in that role? And then, we think about, people forget about judges. I've had people call me, oh my gosh, I'm on my way there. What were the judges? I'm like, you live in Durham. I don't know, so we want to remind people about there's 3 branches, and don't leave out the judges, your county commissioners. Your municipal elections will be on odd years. It'll be 2021. So let's start thinking about that. And quite frankly, if you don't see anyone, but think about this. And as a local official myself, one of the things that we do, and I do when I lobby on behalf of my town, is say, we're the people who see the people first. You don't see them first. We see them first. We live with them. We shop with them, worship with them. Kids go to school with them. And so we're telling you, we want control over what needs to happen in our community and what dollars come, for example, from the federal package. We want to have a say in that. And so what you want to do is, if you can't find people who will speak up for you and amplify yours for you, then you run. Because we want to remind people that healthcare is on the ballot, public education is on the ballot, equity is on the ballot. So.
Absolutely. Thank you so much. Mm-hmm. So we're getting some really good questions coming into the chat box, and most of those we'll hold for the Q&A portion. But while we're on this topic, I would like to ask Nicole or Brigid, either one can address this, but what is the reason that we have struggled so much to get Medicaid expansion passed? And is it true that, my understanding is, it had strong bipartisan support among the people? So what is the current reason being given to not pass Medicaid expansion?
I'm like, okay, we're with faith folks, so I gotta watch my language, because this really does get my blood boiling. And this kind of ties into why it's so important for us to be voting in this election. you know, right now, the people who are currently in our state government, they're not poor and working people. They are primarily white rich men who don't suffer, who are just fine, and they want to keep the system as it is. They don't care about us. They don't care about the Black, brown, and white working communities that are needing this, wanting this. And, you know, in a lot of ways, they've rigged the system in our, in their favor, again, to keep things as it is. And so, you know, in North Carolina, we don't win our elections by landslides. Like, we win them by margin. Governor Cooper won in 2016 only by 10,277 votes. If we are really going to win Medicaid expansion in 2021, which I genuinely believe is possible, we have to have everybody in every county go out and vote, because that's how we're going to pull ahead and actually get the public mandate to expand healthcare to be a reality. You know, we're gonna see, they're predicting about 1 million more folks from 2016, both registering and voting. So we've got about 7 million people that are gonna be registering and about 5 million voting. We know that, the sort of uncertainty of how to vote, you know, people need to start making their early voting plans now. If you are going to go in person, get your PPE, get your individual pen, get your mask, get your gloves, go 2 weeks early if you can. If you are an essential worker, and God bless you if you are, mail in your ballot early, request it, mail it in early. We need to be able to track so that if any funniness goes on, we can be there to help make sure that it gets in. But until we change who's in office, I saw that Carrie McBain is on the call, who is a Down Home member. She is from Silva. She ran for office for the first time in 2019, lost on a coin toss, and like, how is that democracy? But like, you know, next time we're gonna get them. We need Carrie McBain's in office. We need people who know what it's like to not have health care, who know what it's like to work 3 jobs, which is not an understatement around how a lot of people work and live. And when those folks get in office, they'll pass policy that they know will benefit all of us. So I just think we've had a rigged system with rich white men running stuff that isn't serving us, and we've got to get some of them out and get more of our people in. But we really just have to emphasize participation, and making our voice heard.
Absolutely. Thank you very much. Nicole, anything you would like to add to that on the importance of voting?
Yeah, I mean, Brigid did great. I mean, I think we just can't underestimate, you know, what W.E.B. Du Bois talked about, like the problem with colorism, you know, and in the 20th century, and it keeps going. And so if all the people that we've elected, we the people who have the power, so if they get elected and understand and truly believe that it is we the people that deserve to have access to all the things that we should have as Americans, if they believe that, then policy would work. Having poverty, having people sick, and that's a policy decision. We can fix that because we fix a lot of things that when it affects them. And so I think that we can't underestimate the importance of letting people know what your issues are, and that you do, like this my saying, they represent us. That's exactly right. But if you can't find anyone to represent you, then think about if it's your turn. Think about if it's your turn. When I ran for office, people asked me to do so because I was a Moral Monday speaker talking about the numbers of people, and they came in and dragged me out of here like, you have got to do this, so you guys are crazy. I'd rather speak truth to people in power. I don't want to be behind the microphone. But I prayed about it, and it was a week before I had to decide, and all these people I had no idea of were asking me to run for office. And so I did, and I was the second woman of color to ever run, and it had been 20 years ago when the first woman ever was a Black woman who was a business owner who ran. And then 12 years before that was a white woman business owner. Before that, no one else of color ran until I ran. And then 2 other women ran, and myself and the teacher were successful. And so you can, in a town like Apex, where we didn't have diversity of gender and of backgrounds of, you know, nonpartisan, but D or I or R, you know, we didn't have that in any of those positions or in mayor either. And now we have some diversity of age, of even where we fall sort of with being progressive or, you know, in the middle, or, and having the first Black mayor who was a former police captain. So you can make a change, but you gotta stick with it and people have to back you. And I had broad support from Tea Party people to people way, you know, more progressive than I think that I am, who felt like, you know, when I was trying to get buses off the main road, I didn't ask, well, what do you register? How do you vote? It was like, here's what you do, model what I did and send it to the school. And here's what you do to DOT to get that. I was doing that as a community member. And so that is why I had very conservative to very progressive people all throughout support my campaign. They believed in me as a municipal leader and didn't worry about where I was on Medicaid or anything.
Awesome.
So the people who got me in, and that's who I serve.
Thank you. Thank you for that reminder. I think most studies that you read, there is strong bipartisan support for healthcare. There is strong belief that healthcare is a human right. Certainly among people of faith, but also among many secular folks too, who are not people of faith. They do believe that, and it has become a political football that I hope we can take back this fall. I think we want to leave some time for question and answer. So we would love to give our speakers a round of thumbs up or some snaps, or if you're a really Zoom expert, you can do your little reaction down at the bottom of the screen. Thank you so much, Nicole and Brigid, for being with us today, and especially for all of the work that you're doing to make healthcare a human right for North Carolina and the country. I'd like to just urge everybody to learn everything you can about healthcare. It is, in some ways, it's pretty simple if you believe it's a human right, as we do. But in other ways, it is pretty complicated to know the ins and outs. And there are a lot of myths that we'll talk about a little bit in our Q&A section going around. But we would invite you to learn a lot more about it, to challenge the candidates who are running, as well as the representatives who are in office. So with that, I'm going to turn it back to Sarah to talk a little bit about voting. Thank you, Sarah.
Thank you, Chris and Nicole and Brigid. This was an incredible conversation, and I know it will continue to be wonderful as we dive into the Q&A here in a moment. But this conversation has really illuminated for me, and I think for all of us, the values behind our vote, why our vote matters, why it matters that we get to the polls. So now I want to talk just a little bit about how we vote and offer some information around voting this election in particular. So lots of links in the next minute or so are going to be placed in the chat. And I want you to know that these links, in addition to a recording of this conversation, will be emailed to you before the end of the week. So you don't have to rush to get a pen and paper or copy the chat or anything. You're gonna get these links. I also want you to know that I am not an expert on voting, but all of these resources do come from the experts. And if you would like to dive deeper with them, we will be hosting representatives from Democracy NC, You Can Vote, Action NC, and the League of Women Voters for a deeper dive discussion about this election cycle during our September 9th forum. And you can register for that conversation today. That information is being placed in the chat now. That said, we want to remind you again to please download and help distribute our voter guide produced by Interfaith Power and Light and Faith in Place. Again, this guide does an incredible job of highlighting intersectionality and making the real life implications of why our vote matters, and just how this is all enacted on the ground. We also want to remind you to please fill out the census if you have not already. These issues are connected. The last day to complete the census is September 30th. And we know that a lot is on the line in terms of funding and support for our communities in terms of who fills out the census and making sure that we all fill out the census. So please do encourage the folks that you know to fill out the census. They can do that online. And if they haven't already, again, it is due by September 30th. That information is also in the chat and will be in the email that we send soon. So now to the specific voter information. We want you to know that you can check and update your voter registration online. Most people can even register online. So we want to make sure that everyone on this call is registered to vote. We want to make sure that your communities are registered to vote. And we are dropping a link into the chat to help you check your registration status. You can share that with your communities as well. And please do check your registration status, even if you're just positive that you're registered to vote. If you have moved since you last voted, please especially check your registration status, make sure everything's good to go. We also want to highlight a resource from You Can Vote, a wonderful organization working in our state that shows how the people elected to office this election cycle will impact healthcare. So this resource is currently being placed in the chat, and it is really helpful to understanding your impact, but both up and down the ballot. We know, as Brigid and Nicole have both said, local and regional government really does matter in regards to these large issues. So check out that document to understand all of that better. We also want you to check out the broader You Can Vote voter guide, and that link is being placed in the chat. It has lots of great information for you as well. So many questions about this election cycle. Hang in with me, I know this is a lot. Many questions about this election have been about the reality of voting by mail. And how that's more significant this time because of the reality of COVID-19, which we've named in this conversation. Of course, as Brigid mentioned, you can still vote in person, get yourself all donned out or, decked out in your PPE and get ready to go. But many of us who are immunocompromised don't feel comfortable doing that this year, and we understand that. So if you want to vote by mail, the most important thing that you can do, and the thing that you have to do, is you must fill out a vote by mail request form. You have to do that to vote by mail. Information about absentee voting from the State Board of Elections and Democracy NC is being placed in the chat now. Please check that out and check with your county specifically for any localized details. Fill out your request form at your earliest convenience as soon as you can. Let's get ready to vote and vote early if we can. One more thing. So to learn about the realities of the election and do voter education work in your own communities, we really do encourage you to complete an online voter empowerment training with You Can Vote, and check out the latest statewide virtual voter education training from Democracy NC, which is happening this month. It would be great to attend either or both of these trainings before our September 9th forum, which will host both of those organizations. It'll help us have a much more informed and just deeper conversation about voting and democracy in our state and country. Again, remember that all of this is going to be sent to you in an email, all of these links, in addition to a recording of our meeting, so don't fret. But thank you again so much for listening, for being here. And now we are going to go over to Susannah Tuttle, who is the NCIPL director, for our Q&A time. So thank you. Thank you, Susannah.
Thanks, Sarah, and thank you so much, Brigid and Nicole, again, for your powerful presentations. And Chris, what a great job facilitating. I certainly have learned a lot as someone who spends all of my time working on climate justice and the impacts of climate change on our congregations across the state, everywhere. Connecting the dots with healthcare and climate impacts is something that we need to be doing increasingly everywhere we go, and understanding that reality, and certainly in this time of the pandemic and the COVID climate connection, is really, really important. So I'm grateful to have the questions that came in from the chat. So I'm going to start and I hope to hear from each of you on this from your perspective. But we are hearing a lot about Medicaid for All, and we talked a little bit about Medicaid expansion and what's keeping that from moving forward. But can we debunk some of the myths around Medicare for All? We know this is not impossible, so I'd love to hear your perspectives on that.
Yeah, I'm happy to start with that. So again, kind of going back to the original point around how healthcare for all is a moral issue. A lot of, I feel like the arguments against it is around the cost. Like, it's going to cost too much. It's going to bankrupt our state. The reality is we are already paying more than any other country in the world for healthcare. It is, we had this event on Saturday at Down Home, and we were talking to somebody, and one of our organizers said, what's radical isn't healthcare for all. What's radical is the concept of a copay. Like the fact that we, again, are still thinking in this mindset that we need to pay for it and that it is expensive and therefore this shouldn't happen, is just disgusting. And so I'll break the myth. So I'm not an expert here, but what they are saying if we implement Medicare for All is that in between 2017 and 2026, that we would be spending 37.8 trillion compared to what we would be if we kept with the system as is. During that span of time, it would be 42.9 trillion. So actually it's less than. Right now, I'll just say it one more time. If you're saying it's too expensive, if you're looking at 2017 to 2026 as it currently stands now, you would be spending 42.9 trillion. But if we implemented healthcare for all, it would be 37.8 trillion. So for those that look at dollar signs when they're thinking about lives, oof, there you go, it's cheaper. And the only other thing I would say around a myth is that, you know, they say that the waiting lines are gonna get terrible. Like, look at Canada, like nobody can get care. Guess what? Nobody's getting care here because we have so many underinsured people. 40% of folks in the US right now don't even go to doctors. They skip an exam. They don't get their tests because they can't afford it. 32% don't even get their prescriptions filled. We have given members in Silva $30 to pay for their medicine because they can't afford it. People can't afford insulin here. I mean, don't tell me about wait lines and bad systems. Like, this system sucks. And so what we're seeing is it's already bad. And that don't let that lie fool you, because honestly, other countries that have this are better off on prescription drug costs, getting seen on time, and having more people getting tested because they know they can, because it's free.
Yes, that would be amen. One of the other things we hear, kind of tagging on that one, is about the quality of healthcare. Well, our quality would go down. We have the best, most innovative healthcare in the world, and that's because it's a for-profit system. And so we hear that a lot, but the reality is our outcomes in this country are some of the worst in the world. And there are a lot of reasons for that, but part of it is the access to care for all people so that we can prevent some of these illnesses and stop some of the rotating doors in and out of emergency rooms. You know, I will admit, for many years of my life, I was under the, you know, I believed what you also hear. Well, people can go to the emergency room. People don't have to go without care. While it's true, you can show up at an emergency room, you can't get follow-up. You can't afford the medications that you leave there with all those prescriptions in your hands. So what you do is you wind up, if you're lucky, back in the emergency room, and it's just a vicious cycle. So lots of information, and I would definitely encourage anyone who wants more information to either reach out to us, and we can do another event just on Medicare for All. We'd be happy to do that. And there is an event tomorrow with the Medicare for All Coalition of North Carolina that we dropped into the chat box.
Yeah, I would add too, to make sure that in the presentation that I did, I included some of the things that you'll hear more about in that event. But I just wanted to add that for some reason in this country, we don't believe that the head is attached to the body. And for some reason, we can't get dental care and vision care and mental health care. You know, we can't get that all together. It has to be, you go over here, you know, and so that our, you know, fractured system where we don't have integrated, coordinated care, especially as we age, it's just terrible. And so I think we want to, that's another thing I want to raise. The way we look at healthcare is so fragmented, even from the body. And so I just want to mention that. And in the slides, there's also a side-by-side of the two bills that are in Congress, and so what they do. So for folks who wanted to pay attention to that, it's great, helpful information.
Oh, that's super helpful. Yes. And the slide deck is going to be included in the resource packet with all of the links that have been dropped into the chat box that Sarah will send out to everyone who registered for the event. And then you can share that out with your networks and congregations as well, including a recording of this presentation, because I think what is being stated, I mean, this is just, you're speaking truth, you're preaching, you're speaking truth to power. And we do need to get this out far and wide across this state and across the country, across the nation. I really appreciate the attention, and I'm going to start with you, Nicole, on this, because when you talked about even running for office, sometimes we have to pray on it, and our relationship to our faith and our spirituality and your connection to our physical self and our bodies. And I think that that's why through this Faith Values Voter Guide, we really want to get to the moral imperative of why healthcare for all and access to healthcare is a human right. And so the question came in that all major religions have caring for the poor and disadvantaged as a principle, and they do much good. But what is the moral basis we can use to convince our friends who are spiritual but not religious, who are a large part of America today?
To convince them that that healthcare is about morality, that providing that. Well, I mean, I can go out a step further and say, I've not met anyone that says, I don't believe in Martin Luther King and his dream. So I'll just go to, right? And so I'll just go there. If we believe in his dream, he often spoke about, not just say healthcare, but just the whole person, the whole body, the humanity. But his wife, Coretta Scott King, talked about the violence on the poor, and that to withhold from people who are poor is violence. And so when she talked about that, when you don't care for mothers and children, it's violence. And so if we esteem, but they killed him too, right? But if we esteem the person, the humanity, the messenger in Dr. King and his wife, just think about how long ago, how direct she was about, just think about that as a leader, that you're actually withholding things from people. So whether you're a person of little faith, strong faith, no faith, whatever, your morality comes from you, whatever it is, that to see someone suffer, and we know that there are people who, when they run to an accident, they run, like people often run towards people, even if they don't have training. They often run towards people, like children don't have enough food to eat. They don't ask whether the parent is registered as Democrat or Republican or independent or unaffiliated. So why is it that we don't run towards people when they're telling you or showing you that they don't feel that they're being treated equitably when they go to see the doctor, that they understand that they feel like they've been ignored when they say to the doctor, like, this is what I'm feeling and this is what I'm hearing. But then the woman delivers, true story, her baby, and the baby, and then they find she has cancer, and then the baby is sick, and then she gets Medicaid. But then when the baby dies, what do? They pulled her Medicaid from her because she didn't have a child anymore. So if that doesn't move you into action, then I don't know what will. That to me, and now today, she lost her job. So then she lost her health coverage when she did end up getting coverage. And now she is homeless. And so she's on someone's couch. And so this is a story that we have gathered, that we have collected and trying to move people. And so when I bring that story up to our leadership, that at that moment, they should be calling people in and getting pens and getting ready to sign things out.
I appreciate that so much. And it is those real stories that we need to be sharing. And Brigid, in our last minute, if you want to speak to that and the stories, anything else that you want to share before we close out, because I know that that's the work that you do every day in and out with the people in our communities.
Nicole, I didn't have to say, like, that made my palms sweat. Like, that, like, hit me in my gut. Like, oh my gosh, my heart goes out to her. And I think, to me, it's all about the centrality of love. People of all faiths, spirituality, it's holding love in your heart for, again, your family, yourselves, and the human community that you don't know, but you are just intrinsically connected to. And so I really hope that is the place from which we all have these conversations and move to action, because we need each other. We are better when we're together. And the more we just center love and break through the hate and break through the myths of who's deserving and who's not, that's BS. That's not us. That's somebody else that doesn't represent us talking. So I just think that it's about leading with love and building with love that will get us to a better place with everybody.
That is it, isn't it? And that is what the North Carolina Council of Churches is all about. All of our program work, it's about health and wholeness and leading with love. So I want to thank you both so much. I'm going to hand it over to Jessica Stokes for our closing prayer. And I just want to remind you all that next week's forum is on economic justice, the piece in the voter guide. We have some spectacular speakers. All the information is in the registration link, so please spread the word. And Jessica, if you would close us out in prayer, I'd be really grateful.
Thank you. Please pray with me. Dear Spirit of life and compassion, thank you for all the ways that we can find health in you, for the convictions you give us about what health is, what health can be, and what access to health care should look like. Steer us in this world as we strive to live fully with health and wholeness, convicted by what convicts you. Steer us as we work together to heal this broken system and create a moral healthcare system and close the gap. From rural healthcare access to affordable medical care to mental health and harm reduction, maternal health, healthy aging, expanding Medicaid and Medicare for all, and bringing hope to chronic pain, and to access to clean drinking water and affordable fresh food, and to our global pandemic and every health concern that we carry. Be with us. Sustain us in our work and in our hope. We know health because we know you, God. Let us always choose dignity over profit and all that is wholeness. Amen.
Amen. Thank you so much, Jessica. Jessica is one of the directors of the programs that Partners of Health and Wholeness is leading on mental health and wellness across the state. And we appreciate you. So thank you so much, everyone. Thanks to Partners in Health and Wholeness for putting this together, to Sarah from NCIPL for being our fearless leader and getting all of these forums for the 8 weeks organized with all the speakers, to Down Home North Carolina, Brigid Flaherty, and the North Carolina Justice Center, Nicole Dozier, for all that you wisdom, grace, power, and vision that you brought to this session today. We love you all. We wish you safety and peace and justice and a good day. And thanks for everybody for joining us on the chat, for participating. Share this on Facebook Live. Go back and you can find it. It's on the North Carolina Council of Churches page, on NCIPL's page, on PHW's page, on our personal pages. Like us, friend us, follow us, and we'll see you all very soon.
Thank you.
Thank